Content presented in Cheshire Corners is for educational and informational purposes only. Please consult a legal professional if you have any questions or concerns about the content of this disclaimer, this series, or the legal implications surrounding psychedelic substances in your jurisdiction.
For many military veterans, the scars of war run deep. Some of the most devastating wounds are often invisible. Traumatic brain injuries, TBI, head trauma, post-traumatic stress disorder, PTSD, anxiety, and depression. Far too many veterans continue to struggle searching for effective treatments to address TBI and its long-term effects.
Traumatic brain injury, or TBI, is defined by the Cleveland Clinic. Traumatic brain injury is a serious medical issue that affects how your brain works. You can get a TBI from a hard bump or jolt to your head, or if you're hit with something that penetrates your skull. TBI injuries are a major cause of death and disability in the United States. They can cause short and long-term medical issues that can affect every part of your life.
For centuries, the African iboga plant has been central to the spiritual practices of the Bwiti and Mbiri tribes, where it is used to induce powerful visions during religious ceremonies. Ibogaine, the primary psychoactive alkaloid derived from the root bark of the Tabernanthe iboga, has long been valued in these traditions for its spiritual and healing properties. In the early 20th century, Ibogaine was isolated and marketed in France as an antidepressant until safety concerns led to its withdrawal. By the 1960s, Ibogaine gained renewed attention when U.S. heroin users reported that it alleviated their dependence on opiates, sparking scientific and cultural interest in its potential as a treatment for addiction. In the United States, Ibogaine is classified as a Schedule I substance under the Controlled Substances Act, a designation that indicates no currently accepted medical use and a high potential for abuse. According to the Drug Enforcement Administration, the DEA, these legal restrictions have significantly limited scientific research into its potential therapeutic applications. Most recently, though, a resurgence of interest in psychedelics has emerged in response to the growing mental health and addiction crisis. Researchers, clinicians, and patients alike are revisiting compounds once dismissed or restricted, exploring their potential to address conditions that have proven resistant to conventional treatments. Among these, Ibogaine has re-entered the conversation, not only for its cultural and spiritual significance, but also for its reported ability to interrupt addiction cycles and promote psychological healing.
It became abundantly clear to me some 14 plus years ago as we came into contact in a very intimate way with a then young Navy SEAL, Marcus Luttrell, and his coming to live with Anita and myself, and us seeing the challenges that he had with post-traumatic stress, the opioid addiction that was brought on by trying to mask the impact of the challenges that he had from a mental standpoint.
Published in 2018, Dark Classics in Chemical Neuroscience states, behavioral pharmacologic studies in animal models provided evidence that ibogaine could blunt self-administration of not only opiates, but cocaine, amphetamines, and nicotine. These findings hinted early on that ibogaine's effects extended beyond opiates, suggesting a broader potential in treating substance use disorders. Further research has strengthened this case. Magnesium ibogaine therapy in veterans with traumatic brain injuries, published January 5, 2024, states, TBI is a leading cause of injury-related disability worldwide. Participants showed a remarkable reduction in these symptoms with large effect sizes, and the benefits were sustained at the 1-month follow-up. Building on this, A recent study led by Dr. Williams and researchers at the Stanford Brain Stimulation Lab tested Ibogaine with 30 U.S. Special Operations veterans. Magnesium Ibogaine therapy effects on cortical oscillations and neural complexity in veterans with traumatic brain injury, published by Dr. Nolan Williams in Nature Mental Health on July 24, 2025, reported, traumatic brain injury can lead to chronic psychiatric and cognitive problems, coupled with changes to the nature of cortical oscillations and neural complexity. The findings suggest that this plant-based psychoactive compound can be both safe and effective in reducing PTSD, anxiety, and depression, while also improving quality of life for veterans suffering from TBI. Using EEG and MRI scans, Dr. Williams' team observed that veterans who improved most showed increases in a brainwave pattern known as theta rhythms. Researchers believe these stronger theta rhythms may enhance neuroplasticity and cognitive flexibility, key factors in recovery. Remarkably, participants reported an average reduction of 88% in PTSD symptoms just 1 month after a single Ibogaine treatment. No other drug has ever been able to alleviate the functional and neuropsychiatric symptoms of traumatic brain injury. The results are dramatic, and we intend to study this compound further. While science is moving forward abroad, U.S. policy has begun to catch up, most notably in Texas.
They have been looking for a pathway, a therapy, a treatment, a way to deal with and grapple with and have a better pathway in their lives by an alternative that some were able to find on their own, an alternative that we believe should be tested and evaluated for the possibility of achieving FDA approval.
In June 2025, Texas Governor Greg Abbott signed Senate Bill 2308 into law, authorizing $50 million in state funding for clinical trials to evaluate Ibogaine as a treatment for opioid addiction, PTSD, traumatic brain injury, and other mental health conditions, particularly among veterans.
It's now law.
This represents one of the largest state-level investments in psychedelic research in U.S. history and marks a major shift in how emerging psychoactive treatments are being approached in policy and medicine. Texas is home to more veterans than any other state, says Governor Abbott. Many of those veterans suffer from injuries both seen and unseen. A therapy that has shown great promise in treating those conditions is Ibogaine. This law authorizes a Food and Drug Administration-approved clinical drug trial that will seek approval of Ibogaine as medication for the treatment of opioid use disorder and other behavioral health conditions. Texas will now lead the way in America for the evaluation of Ibogaine as a potential medication that can help improve the lives of so many veterans.
Texas is home to more veterans than any other state of the United States of America. Many of those veterans suffer from so many different types of injuries, both seen and unseen. Many struggle with things like depression, PTSD, and opioid use disorder. The same is true for some of our first responders, as well as others who are dealing with addiction-based issues. A therapy that has shown great promise in treating those conditions is Ibogaine. To better understand the potential for Ibogaine, and to better address the public health challenges caused by things like opioid use disorder, an FDA clinical drug trial is needed for Ibogaine. I'm about to sign a law that will lead to an FDA-approved drug development clinical trial that will seek approval of Ibogaine as a medication for the treatment of opioid use disorder and other behavioral health conditions, especially so those suffered by our veterans. Texas will invest $50 million to support this research, and these funds can be matched by grants and private investments. I'm proud to sign it into law.
Conventional treatments for PTSD often rely on antidepressants and anti-anxiety medications. While these can ease symptoms, they do little to address the underlying traumatic brain injury, TBI, that frequently drives the condition. Ibogaine, by contrast, is thought to act directly on TBI by promoting neuroplasticity, the brain's ability to adapt and form new neural connections. Yet, more research is needed to fully understand how the compound achieves these effects. Is this $50 million Ibogaine investment the breakthrough our veterans desperately need? The science is promising, but policy moves slowly, and for our veterans, time is running out.